Hi, my name is Sarwat Rumi. I'm a doctor of acupuncture and Chinese medicine, which is different from an MD, a medical physician. I've been working with the adult patients at Roswell Park since 2018. In this video, I'll talk about how acupressure can provide symptom support for cancer patients and survivors, and we'll locate a few points together. The information that we will be discussing today is also available in written form as a blog on the Roswell Park website. Thanks for watching. We can't talk about acupressure without talking a little bit about acupuncture. Acupuncture is a medical procedure that dates back at least 1,500 years, originating in China. Very fine needles are used to stimulate points along the channel network of muscles, tissues, fascia, and vessels throughout the body to treat a variety of symptoms, including pain, nausea, and anxiety. For more information about acupuncture, please check out the acupuncture video linked below. So we can use those same points and stimulate them by hand to treat the same conditions. This is called acupressure. The stimulation is not as strong as needling, but it can be very therapeutic nonetheless. Some things to be cautious about when giving or receiving acupressure. Use your fingers or a designated rounded tool to provide pressure. Never anything pointy or sharp. Do not put pressure on broken skin or directly over tumors, lesions, or rashes. Not all points are suitable during pregnancy. Check with a licensed acupuncturist or your gynecologist if you are unsure. Here are a few points that you and your loved ones can try on yourselves and each other. The first point that we're going to locate is Yintang. It's located in the region of the so-called third eye, just above the eyebrows. This helps with stress, anxiety, headaches, and sleep issues. So to locate this point, we can just take one finger or two fingers and place right above the eyebrows in the center. So we can apply continuous pressure, or we can massage this point for relaxation and relief. You may also even feel your sinuses clear a little bit if you massage this point. The next point that we are going to locate is Pericardium 6. This is well known as the nausea point. To locate this point, it's located on both wrists, remember, so pick a hand that you want to locate it on, and then on the other side, you'll hold your 3 fingers close together, and then you'll want to line up the outer edge of the ring finger with the crease of your wrist, the main crease of your wrist, like so. Good. And then, do you feel 2 tendons on your wrist? So your fingertips are going to fall right in between those tendons. Where your index finger lands, that's the point. So this, again, we can apply steady pressure. You can be pretty firm with this point. You can also massage it. It's also good for anxiety or insomnia. And the next point that we're going to locate is large intestine 4. This is well known as the headache point. This one is located in the web of the hand. With the opposite side, you'll use your thumb and your index finger to just pinch right in the web of the hand and massage out any places that feel especially tense or sore or tight. So this is indeed good for headaches. It's also good for pain anywhere in the body. To note with this point, if you are pregnant or think you may be pregnant, please do not locate this point today. Do not apply pressure to this point. It's actually a point that can stimulate or assist in helping someone in delivery situations. So Ren 12 is on the abdomen for people with GI cancers. If you know you have tumors in this area or you've had surgery, especially recently, please check with your doctor before applying pressure to this point. This is located on the midline of the body. To locate this point, let's feel our ribs, the bottom border of the rib cage, and we can walk our fingers up toward the center. And then do you feel where that kind of meets in a little V there? So we'll keep one finger right there. The other finger is going to drop down to the navel. And the point is located halfway between these. Yep, there you go. So the point is there. This is very good for anything, as you might guess, anything gastric related, any nausea, stomach pains, difficulty digesting. This is also good for the lower abdomen issues too, so any constipation or diarrhea. This next technique that I'm going to show you is specifically for constipation. We're going to kind of walk our hands down to maybe a few inches above the ankles, and then we'll walk our fingers to the outside border of that shin bone. We're going to apply firm pressure with 2 or 3 fingers, and we're going to pull up right along that outer border. Good. So you can do this a few minutes before you go into the bathroom. If you are in the bathroom and you're having difficulty, then you can do this while you're sitting there. The last point that we're going to do today is on the sole of the foot. It's kidney 1. This is a very strengthening and calming point for the whole body. It's also helpful for headaches, dizziness, and sleep issues. And we're going to locate it today on the bottom of the foot, just behind the ball of the foot, and almost in the center. If you draw a line from the base of these toes right back to just beyond the ball of the foot, that's the point. You've got it right there, yep. And so you can apply steady, firm pressure. You can also massage that point. If you are someone who's having a headache or you're feeling dizzy, you can apply pretty firm pressure to that point. This is, again, a very restorative and strengthening point, so you can apply pressure here for a few minutes at a time on loved ones who are in bed and could use that kind of support. Now that you've located a few points, give them a try. Feel free to review this video or check out the written blog for reference. If you're interested in an appointment for acupuncture and acupressure, ask your provider at Roswell for a referral. Remember, if you have concerns about applying pressure to certain areas, please ask your oncologist first. Thanks for watching. Take care.